So I'm so grateful to have Suzanne Desailly joining us today. Suzanne's the General Manager at Mates in Mining, which is an evidence-based peer-led suicide awareness and prevention program for the mining industry. Their approach is a transition from a more traditional help-seeking framework to a help-offering approach. And I can't wait to hear from her so that we can all learn how to be better support for each other, especially when we need it the most. So thank you so much, Suzanne, for joining. It's wonderful having you.
No, thank you so much for the invite, Jess. Really pleased to be here. So I guess it's actually quite timely that I'm here talking to you today. So many of you probably know today is World Suicide Prevention Day. And also yesterday, for those of us in Australia, it was Are You OK Day, which is a day that's really around sort of raising awareness of mental health issues and the importance of sort of reaching out and asking people, are they okay, and really sort of recognising the importance of connecting with everyone around mental health issues. So, and I guess that's what I'm here to talk to you all today about. So who is Mates in Mining? So predominantly what we're about is preventing suicide in the mining industry. But before I sort of talk about what that means and how we do that, I'll just talk a little bit about sort of how we were established. So we actually work across multiple different industries. So the organisation started about 12 years ago in the construction industry. So we first started out as Mates in Construction, and that was really, we were born out of the high rates of suicide that the Australian construction industry was experiencing. And since then we've transitioned into numerous other industries. So we're in Mates in Energy, we're in Mates in Manufacturing, and Mates in Mining. So I oversee our Mates in Mining and Mates in Energy initiatives. But across all of the programs, as I said before, really the main focus is to support workers across all of these industries who are struggling with mental health issues and suicidal ideation. And I guess the reason we do that is because in Australia, and these are all, I'm mindful there are people on here from all of different parts of the world, but these are Australian-based statistics, but obviously they'll probably be very similar to other countries. So the problem really that Mates is addressing, we know that 1 in 5 Australians will experience a mental health issue in any 12-month period. So that's about 20% of us. And if we think about the sort of mining workers across Australia, we've roughly got about, say, 250,000 across Australia. So at any given point this year, we could potentially say that about 50,000 workers in the industry will experience a mental health issue. And we also know from a report done by the Western Australian Mental Health Commission a couple of years ago that 1/3 of all fly-in and fly-out workers reported experiencing high or very high levels of psychological distress. Now, we know that not everyone who experiences a mental health issue will experience thoughts of suicide, and vice versa. Not everyone that contemplates suicide or experiences suicidal ideation has a mental health issue, because a lot of the reasons people might struggle with thoughts of suicide, there are various reasons for that. It's not only mental health issues, but we also know that there is a high correlation between someone experiencing mental health issues and their increased risk for suicide. We know, again, these are Australian statistics, that in 2019 there was 3,318 suicides in Australia. Now, we know that figure is probably likely higher because these are the deaths that were deemed suicides by the coroner, and there's probably likely many more, and people often say probably it's 20% higher people who have died by suicide where it hasn't been registered as a suicide. But we know in Australia, on average, about 65,000 Australians will make a suicide attempt each year. And we know that suicide is a leading cause of death among people aged 14 to 44, with males consistently accounting for about 75% of those deaths. There was a bit of a study back in 2015, they looked at the coronial data around deaths by suicide by occupation over a 4-year period, and they found that construction and mining workers had the highest rates. So I guess these are the issues. These are the reason. This is the reason why Mates in Mining exists. We know that the mining industry is largely a male-dominated workforce, so we know that there's sort of at increased risk based on the high rates of suicide in the male population. But I guess we've got a lot of those risks, but then we've also got past 18 months that all of us, no matter where you're sort of joining us from across the world, has experienced, and that's COVID-19. So I guess COVID-19 has brought with it a series of other issues that are really adding to the mental health challenges that the resources and mining workforce is experiencing. And that is increasing their risk of suicide. So the mining and resources industry, I guess, is really dealing with many issues in addition to the health consequences of the coronavirus itself, all of which are really adding to the psychosocial challenges that workers in this industry face, placing greater risk on their mental health. So I guess we've seen, and it might be different across different countries, but particularly in Australia, at the height of the pandemic, and also we're still seeing it now, things like border closures and inter and intrastate travel restrictions has really impacted on the availability of workers, particularly fly-in, fly-out and drive-in, drive-out workers. So in response to this, a lot of mining companies, as you'd likely know, have extended or lengthened the rosters to try and reduce the volume of sort of people flying and travelling. And some are making workers sort of residential on, closer to site for longer periods of time. So all of this means longer periods that these workers are experiencing away from family and loved ones. And we know from the research that's out there, we know that people on shorter rosters experience better outcomes on all mental health and wellbeing measures. So once you lengthen those rosters out, you're really putting a big impact on people's mental health and wellbeing. We've also seen that adherence to many of the sort of social distancing restrictions that a lot of us have had to experience to fall in line with sort of state and federal government directives have meant that, for a time there, many of the sites had to close access to things like gyms and other sort of on-site recreational activities for the workers. And also their capacity to access sort of local community recreation activities was limited in many cases. And we know that, for workers on site for long periods of time, it's that connection to social and recreational activities on site that really improves mental health and wellbeing. And when that's taken away, that can be really detrimental to people's mental health. A lot of social distancing restrictions has also meant that some workers in the mining and resources sector have had to make some changes to the way that they carry out their day-to-day work. Many have often had to take on sort of additional roles, additional functions to cover for staffing shortages or staffing reductions, all the while remaining under some fairly sort of tight production deadlines. And also we've seen globally that the pandemic has had an impact on the market environment. So many mining and resources companies have had to align production with demand. And this is, and we've seen this particularly in New South Wales, this has meant a lot of, I guess, concern and anxiety for workers about what that means for their jobs. And I guess the other thing that everyone is experiencing, regardless of what industry you're working in, is just that sort of lockdown fatigue. So in Australia, numerous states have been in and out of lockdown. And that just brings that sort of overwhelming sense of fatigue and burden for people. So I guess COVID, that there was risk factors there already for workers in this industry, but COVID is really, I guess, creating some heightened pressure with an already fairly pressurised and deadline-driven environment. So all of this means, I guess it sort of culminates in the fact that people are at increased risk of suicide. And we know that suicide is a really complex issue, but we also know research tells us that there are some fundamental protective factors that make us more resilient and can reduce suicidal behaviour. So these are things like having supportive relationships, having really positive connections to good health and support services. And ultimately, this is what Mates in Mining is about. We're here to build and strengthen those protective factors within the workplace. And the way that we do that is through building the capacity of the workforce. So the Mates in Mining program is very much a grassroots program. It's mates looking out for mates on the work site, on the mine site. It's colleagues looking out for colleagues, workers looking out for workers. So as I said, very much a peer-based grassroots program. Now, there's real value in having these peer-based workplace programs, because we all know that a lot of us are spending, well, apart from being in lockdown, a lot of us are typically spending a lot more time at work. So we spend a lot of time during the week with our work colleagues. And for some of us, we're spending more time with the people we work alongside than we are our sort of family, friends and loved ones. So what that provides us is some real opportunities, I guess, to recognise some of those subtle behaviour changes that your colleagues and the people you're working next to might be exhibiting to suggest that they're struggling with their mental health, or that they might be struggling with thoughts of suicide. So some of the things through our training that I'll talk about in a minute that we sort of encourage people to look out for are things that, I guess, some of the changes that you might see in those people that you're working alongside. So things like increased sort of moodiness in someone who typically isn't someone who's particularly moody. They can become a little bit careless in the way that they carry out their role. They might become a little bit distant. They just don't have that same connection with their work colleagues that they once did. Their attitude about things might change. You know, they might actually have a good or a bad attitude traditionally, usually, and then that suddenly changes. Their alcohol or drug use might change. So for some people, they might use more alcohol or they might engage in drug use. For some, they actually might reduce it. It's just changes in whatever their normal pattern is. Some people might engage in more risk-taking behaviours. People might be doing things like starting to give away possessions or putting their affairs in order. So these are all the things that you know that we train the workers to start just looking out for. And if they're starting to see these things, then just to recognise this might be a change, and this might suggest that someone might be struggling. You can also sometimes, and this is what we talk about in our training, it might be just things that you sort of sense or hear. So, you know, you could just be picking up that someone is just feeling a little bit lonely, and they could be using the word like, you know, loneliness, or I'm suddenly feeling lonely, or there's no one in my life, or I'm feeling helpless, or they use the word escape, they're looking for an escape, or you just sort of pick up or sense that they might be feeling depressed or feeling a burden. And sometimes, though, it's really just a gut feeling that you might have about someone. So these are all of the things that through our training we sort of get people starting to think about in terms of these. Sometimes for some people could be some of those subtle indications in terms of behaviour changes, or subtle invitations that suggest someone might be struggling. And as I said, we spend so much time with the people that we work with that it's actually useful to leverage that and think, all right, you know, let me think of those people around me and how they're going. We also know that males, particularly, research has shown this, that males have very poor help-seeking behaviour when it comes to their general health, but particularly their mental health. So I guess our program, as Jess said at the beginning, is very much a transition away from those more traditional help-seeking models, which really put the onus on the individual who's struggling to put up their hand and say, I need help. And we're shifting that focus to more one of help offering. That's really suggesting that if you're struggling with your mental health, or if you're struggling with thoughts of suicide, it's going to be really tough for you to put up your hand and tell someone. But what we do is actually train and support and build the confidence of the people around you to actually notice that you're struggling, notice that your behaviour is changing, and to know how to offer you help. And the way that we do that is through clear pathways of education, training and support, where we're building communities of mates who can look out for mates. And all of the training that we provide to mining and resources workers very much mirrors the sort of safety structures on site. So the language we use is very much a safety language, just so it's familiar when we roll out our training. So in terms of the training, what we do is that we will go to a mine site face-to-face, directly on site. And the first layer of training that we deliver is called our general awareness training. And that typically runs for about an hour, and that's delivered to all of the workers on site. And really what that's designed to do, it's designed to induct the workforce to become more aware of mental health issues and suicide. So we talk about suicide, we talk about mental health, and we talk about it's really important to reduce the stigma around that. We talk about what some of those suicide risk tipping points for people might be. We show people how to recognise risk and also introduce people to some basic help offering techniques that they can use to those people who might be having thoughts of suicide that they're working with. So really what this general awareness training session ultimately does is just to get people to recognise that mental health issues and suicide is a risk for their industry, but there is things that they can do about it to try and reduce that risk and prevent suicide. And also that their workplace is going to be a workplace where it's safe to talk about mental health issues, and it's safe to openly talk about the fact that I'm struggling, because that's really important. So after we deliver our general awareness training to a mine site, we then ask for volunteers who'd like to go on to the next layer of training, which is our 4-hour connector training. So that connector training is designed to support those workplace volunteers to be trained, I guess we could call them as gatekeepers. They're the ones on site who very much take more of a leadership role in promoting mental health and trying to prevent suicide. So those connectors are provided with the training and the skills, and most importantly, the confidence to reach out to someone that they identify that might be struggling, to initiate and hold a conversation, and to connect that mate to help. Now, what I mean by hold a conversation is, as we were talking about yesterday was Are You OK Day here in Australia. And invariably what a lot of people will say is that when they ask that question, they expect the response to be, yeah, I'm fine. When the response is, no, I'm really struggling, or no, I'm thinking about killing myself, often, invariably, people don't know how to respond to that. They don't know where to go with that. That's what our connector training does. It actually provides the skills and confidence for those connectors to stay in that conversation, not to be freaked out if someone says, no, I'm really struggling and I'm having thoughts of suicide. Know how to stay in that conversation, know how to support that person, but most importantly, know how to connect that mate or that individual to help. So that's what our connectors do. And then after the connector training, again, we ask volunteers, so workers who would like to go on to the next layer of training, which is our applied suicide intervention skills training. Now, that's quite sort of more high-level training. It goes for 2 days. And I guess you can liken those assist workers to the first aid officers that all mine sites have, because they're really trained to have those additional skills to support someone who is having suicidal thoughts, but someone who actually might be at more imminent risk. So someone might be talking about having a plan. So they're talking about, I'm going to do this, this is how I'm going to do this, and this is when. So these assist workers can intervene. They can develop what we call a safe plan or a safe contract with someone. And that's really around keeping that person safe and alive now until they're linked into more sort of immediate sort of critical support. So there are 3 layers of training, introducing the topic of mental health and suicide awareness into the work site, providing those connectors with that really important training around how to have conversations, initiate conversations and hold conversations, and then the training for those assist workers to actually intervene and keep someone safe if they're a more imminent risk. So we have what's called Mates Accreditation. So when a mining company adopts the Mates in Mining program, we have a certain criteria for them to receive accreditation, and that is at least we aim for 100%, but recognise that with sort of staff coming and going and that it can be challenging. So we've set the bar at having 80% of all of the workforce receive the general awareness training. We say that it's really important to have a ratio of 1 connector trained worker to 20 workers, and we also say that it's really important that every single worker on site has access to an assist trained resource. That's to achieve the MATES accreditation. Now, wrapped around all of the training that we deliver on site is a lot of other support that we provide to the workforce and to the mining companies. So we have field officers. So our field officers all come from industry backgrounds. So we have our mining field officers all come from the mining and resources industry, and they're the ones that will go directly to a mine site, train the workers face to face. But not only the training, they actually then do lots of follow-up visits, a lot of follow-up site visits to try and help build that sense of community and to try and keep the program really running and really alive on that mine site. But what those visits are really important for is keeping that support, keeping those support channels to the connector and assist train workers, because they're those workers on site that people are going to be reaching out to. They're the ones that are going to be having the tough conversations. So our field workers are there to support those people in those volunteer roles. We also have case managers. So our case managers are all social workers and psychologists who really are there to further assist workers who are struggling with their mental health or having thoughts of suicide. So our case managers work from what we call a brokerage model. So that's really where they don't provide sort of clinical input or they don't provide therapy as such. They can just work with a worker and their family who might need a little bit more time to be linked into the supports they need. So maybe they need financial counselling, they might need relationship counselling or drug and alcohol counselling. Our case managers can work with that individual to either link them into, so mining company X might have an employee assistance program or another mental health and wellbeing initiative. So our case manager will link them in with that, or they might link them in with their GP or other community supports. As well as that, we can also, a big part of what we do is go to site after there's been a critical incident or an accident or a suicide, and we can do postvention support. So a mine site where there's been a critical incident or accident and where they have invited us to site, we can go there and provide that critical incident stress debriefing to the whole of the workforce on site, because as you can imagine, if there's been a workplace accident or if there has been a suicide that has affected that work site and that community, it's going to have a big knock-on effect for all of the workers. So our field officers and our case managers can attend the site, they can do that debriefing with all the workers, but fundamentally what they're there to do is really add additional support to those connectors and assist workers, because invariably in the weeks and months following a critical incident or a suicide, it's those connectors and assist workers that their colleagues are going to be reaching out to. So we need to ensure that there's support wrapped around those individuals. As well as all of that, all mining workers and their families have access to our 24/7 helpline. So if a worker or their family member is struggling, whether that's in the middle of the night or on the weekend, they've got a phone number to call and talk to someone if they need to. The next few slides are just giving, I guess, a bit of a visual or sort of visual imagery around how the program works. So if you look at the yellow hard hat in the middle there, that just signifies a worker on a mine site who might be struggling. So they might be struggling with mental health issues, they might be having thoughts of suicide, and invariably they're going to be feeling very alone, they're going to be feeling very isolated. Now, we know that's not the case. We know that in the community, even in that workplace, there's a lot of support for them. There's a lot of counselling available. There's a lot of support out there. But for someone who's struggling, that can seem a long way away. They either don't know what's available to them or they just don't know how to access it because they're just not in the right headspace due to what they're going through. So I guess our program is really designed to bridge that gap between that worker who's struggling and all of the supports that are available to them. And the way that we bridge that gap is through our general awareness training. So we induct all of the people that work around them to understand a little bit more about mental health issues, to understand that suicide is a risk factor for people, and to really provide that sort of support mechanism. And also for their colleagues to know that this is a safe site. This is a site where talking about your mental health is okay and you'll be supported to do that. We also try and bridge that gap through the connector training. So providing, trained people who actually might be in a better position to identify that that worker is struggling, because they know what to look out for in terms of behaviour changes, and they know what some of those invitations might look like to suggest that someone's struggling. And then we do that through the applied suicide intervention skills training. So if that worker is at more imminent risk and they might have a plan of suicide, then we've got those people who can actually link them into more crisis and immediate support. Now, I've talked a little bit about, mining companies that we work with, might already have existing employee assistance programs, or they might even have other mental health and wellbeing initiatives. And that's actually really good, because the Mates in Mining program, we're not here to sort of work in opposition or in competition to any of those existing supports. We actually work in collaboration and support of those, because a lot of what we do, and a lot of through the training that our field officers deliver to site, we're really trying to encourage people to access the employee assistance program, and we will promote that to all of the workers. And we try and encourage people that, this mining company has this great wellbeing initiative, access that. So we're not trying to actually be in competition. It's actually around just ensuring people get connected to the help that they need, because we know invariably there's often a bit of a stigma about accessing workplace programs. So if people aren't accessing, who else are they getting their support from? And it's around recognising that they can get their support from their colleagues, from the people that they're working alongside, their mates. And also collaboration is really important to us, in terms of, it's really important for Mates in Mining to have that bipartisan support. So we have the support of the employers and the employer associations, but as well as the unions, because we need everyone on board to be supporting our program to make sure that it's embraced well on site. So we have the support of the Minerals Council of Australia and the various sort of state-based councils, and we also have the support of the sort of mining and energy division of the CFMEU here in Australia, because that's really important for us to be able to do our job effectively, is have that bipartisan support. Just some words from some mine workers who've gone through and experienced the program, because at the end of the day, it's actually really their sort of experience of the program that's the most important thing. So just some quotes that people have provided about their experience. So someone said, I had some very old-fashioned views about suicide and people, probably not the most supportive. This training really brought me out of that and really made me realise how, in general terms, someone would get into a position like that, and how successful help could be at the right time if people were keeping an eye out for each other. Another worker, the fact that you're actually able to have discussions with people and they feel like you're taking an interest in them as a person, more so than there to do a role, it's really a two-pronged benefit. The fact that you both walk away from the situation feeling that things are in a better direction, and the person's gone, you know what, he cares about me, rather than he's just being a name on the shirt, is one of the biggest benefits out of it. Just in terms of how we structure the program, so if a mining company adopts the Mates in Mining program, they enter into a 3-year partnership agreement with Mates in Mining, and they basically just pay an annual fee based on the total number of employees they have. So it's a per head rate. And typically mining companies will either do an agreement at the site level or the company level. So we offer a reduced rate if it's at the company level. So that's where, a mining company will adopt the program for all of its operational sites across Australia. But some mining companies want to just do it side by side. So we have two opportunities there. So ultimately, Mates in Mining exists to strengthen the mining and resources industry by preventing suicide, because we really strongly believe that a life saved is one less family grieving, it's one less workplace that's significantly impacted, and it's one less community that's left heartbroken, because we know that suicide has a ripple effect. It not only affects the individual and their immediate family. It affects the workplace, but it affects the broader community as well. And we've seen examples when we did the pilot of the Mates in Mining program. One of the early adopters was a mine site in Clermont in Western Queensland, and they had a group of their workers who did the 2-day applied suicide intervention skills training. And it so happened that just the following week in that community there was a suicide. It wasn't a mining worker, it was someone in the Clermont community, but it had a really big impact on that community. So what the group of miners did is that so Clermont at the time were having they did a weekly market on a Saturday morning. They actually pitched a tent and put signs up to say, we've recently done suicide training through our workplace, but we want to be able to use these skills for people in the community who are experiencing a lot of grief around a recent suicide. So they actually were there and really, encouraged people to come up and talk to them, and they supported the broader community through the skills that they had learned in the workplace. And that's a really important part of our program, is that a mining company might be adopting the program to ensure that they're improving the mental health and well-being of their workers, but they're also training their workers in some skills that they can take back into their broader community. So they can take it home. They can use the skills, with their family, their friends, because everyone struggles with mental health issues, and many people struggle with thoughts of suicide. They can take it into their community groups. They can take it into their sporting groups, their, religious organisations. So all of the skills that people learn and develop through our series of support programs and training and education can all be taken back into people's everyday lives, which is a really important part of the program. And it's certainly something that the mining workers who've done the Mates in Mining program really value. So look, I've done a lot of talking, so I'm very happy to have an open discussion now around, if you have any questions about anything that I've talked about, or, happy to have people's experiences of, the different experiences maybe you've had on different sites around mental health and suicide awareness.
Thank you so much for sharing that with us, Suzanne. I've had one come through just to kick things off. So have you found that discussing suicide triggers action in those who are considering it?
Yeah, no, look, this is a question we get asked a lot, Jess, and that's often a fear that people have, saying, gosh, if I ask someone if they're thinking about suicide, it might put it in their head. But invariably, no, and there's been a lot of research around this, and that no, it doesn't. Actually, what it does, it has the opposite effect. It's actually, for a lot of people who've experienced suicidal ideation, they often say it's such relief that someone just asks them and asks them quite directly, are you thinking of suicide? Because people don't often do that. And really, it's that invitation for them to say yes, and then they can talk about why. And it's actually then that really important conversation happens, and then it's so much easier to connect that individual to help. But I recognise that can be a real concern for people around, I don't want to even say the word in case someone thinks, oh, I hadn't thought about that, I'll give that more thought. That doesn't happen. It's actually really important to reach out and be direct, and not say, oh, we even encourage through our training, it's not even saying, oh, are you even having thoughts of hurting yourself? Because that can mean lots of different things. We actually talk about, it's really important to be, are you having thoughts of suicide? Are you having thoughts of ending your life? And actually be direct, because as I said, it comes as a real relief to people. If they're the thoughts that have been mulling around in your head, and you don't feel like you can talk with anyone about it, but if someone asks you, that's that invitation to say, this is a safe space and it's okay to talk with you about this. You're not going to get freaked out about it. Yeah.
I really appreciate you taking the time. I just had one quick question. Obviously, without having yet looked at the full training program, are there any key takeaways that tools, that someone could use this afternoon that you think would be really important? Yeah,
look, I think, some of the fundamentals are, look, if you're struggling, don't be afraid to reach out and ask for help. But if you also, you know, suspect that someone, you know, in your world might be struggling with mental health issues or suicide, again, don't be afraid to have that conversation with them, because, you know, there's no wrong way to have that conversation. And like I was saying, it can actually be a great relief for people to be able to finally talk about what's going on, you know, in their head. And that can actually be life-saving and life-changing for that individual. I think there's a lot of, you know, you were mentioning before, you know, a lot of you sort of work fairly sort of autonomously. You're not really a part of a team, but there's a lot of really good online resources that you can access. So if you go to the Are You OK Day Australia website, they've got a lot of really good resources. We've got Beyond Blue that has great resources online, and just in terms of being able to look at, you know, read some articles, they've got tip sheets and those sorts of things. So try and there's a lot of online resources that you can do as well. Our program is face-to-face because that's the research tells us that's the efficacy, that's where we get the buy-in from that face-to-face interaction. But that's not to say that there's not a lot of great sort of online resources there. But I guess the takeaway is, don't be afraid to ask for help, but also don't be afraid to offer help to someone who you might think just is, you know, could be struggling. And if they're not, no foul, you know, conversation just goes off in another direction. But if they are, that, you know, you're giving them that opportunity that no one else might have to have that conversation. And that, as I said, can be life-saving and life-changing.
Yeah. No, that's some great advice. I really, really appreciate that. So thank you.